Hello and welcome to the first Mayor's Emergency Roundtable of 2021. I'm Rick West, and I'm glad you're joining us today with a discussion with our local experts on the topic of great interest to all of us at this time. You know, we started this time last year in February. We, as a city, did our State of the City, and we started with the theme, don't throw away your shot. And here we are. I don't think we ever thought that we'd be talking about not throwing away your shot in a literal way. The release of the vaccine is a tremendous step forward in ending this pandemic, and we all have to do our part and continue to mask up regardless, maintaining social distancing and washing our hands frequently, regardless of where we are. We have a lot to talk about today. Things are changing even as we speak. This morning there's an article in the paper that said that the Trump administration is changing its strategy towards getting the vaccine out. Our health departments in Chesapeake have been working tirelessly to get the vaccine out, and so there are a lot of things that we need to clear up and also talk about to make sure that you as the citizens understand where we are as a city. So, Dr. Welch, let me introduce, first of all, our guests. We have, of course, our health director, Dr. Nancy Welch. We also have with us our the health department emergency coordinator, Jerry Tucker. And we also have our nurse manager with the health department, Marian Vollmer. So welcome to, and thank you for being with us this morning. And we also have our city manager, Mr. Chris Price. He's here to throw in what he can tell us about the city's part in getting this vaccine distributed to our citizens. So we started, Dr. Welch, or I mentioned just a moment ago that there was an article in the paper, and I think a lot of people are going to be wondering about that. It says that the Trump administration is changing its strategy to say, everybody, if you're 65 and over, get in line and be ready to have this vaccine. Now, it's interesting that, and he says that's going to happen in 2 weeks. Of course, he will not be in office at that time to coordinate that or make it happen. So it's going to be interesting to see how incoming President Biden reacts and what his plan is going to be. How, in all these changes, how are we as a city supposed to deal with this stuff?
Yeah, I wish I could say that once it's determined, everybody can come and get in line. I certainly, I support the kind of advancement towards these individuals and these ages. These are the population at risk, and that's the whole point of the vaccine. The dilemma that we're facing in the health department, quite honestly, is the logistics of getting adequate vaccine and having adequate vaccinators. We certainly have been working very closely with the hospital and folks in the city to get just even our 1A vaccinated. We still have a lot to do that. But because we didn't want to wait until one is closed to begin the other, we're sort of doing some blending in terms of moving from 1A to 1B. And of course, the 65 and older will move up, so it's not limited to 75 and older. But the dilemma is getting adequate vaccine, getting individuals like private practices and large practices, because that was a big point. We hired 2 nurse navigators solely to work with private practitioners to get them vaccinated, to work through the logistics, because we know the state process to work through all these logistics is cumbersome. It's not necessarily works real rapidly. And so we hired nurse practitioners to work solely with our practitioners so that they could administer to their patients. We know that people primarily trust their primary care providers. We want to capitalize on that because they have a relationship with them. But that is right now a big cumbersome point.
Thank you for saying that. And, you know, it's interesting on the way over here, I don't know if it was circumstance or what, but I did receive a call from one of our larger physicians groups in here in Chesapeake, and they are very, very frustrated. Apparently, they need a V-track number, and they've been through the state, and it's come back to the locality, then back to the state, and they've asked me to see what I could do, and I said the only thing we can do is to ask you all, and you all are overwhelmed. The state is overwhelmed, but it does seem like that would be a fairly easy thing to do to get 1,100 vaccinations to a major, a large physicians group, and as you said, what a better way to do that.
I think what's happened, because this is an emergency use authorization, they have put in far more restrictions because of the emergency use authorization. We went through H1N1, it was no problem. We got lots of vaccine. We provided vaccine very, very rapidly. We know how to organize, we know how to do large events, but we need people to be able to get the vaccine in order to administer it. I know the practice you're talking about, and we're very pleased that they're delighted to do it. We've worked with them. And we'll certainly go back and have our nurse navigators go back, contact the folks in Richmond. We have been contacting Richmond on behalf of our providers numerous times. And that is what we want to do. Providers call us because patients are calling us, community is calling us, and we want to be able to say, go to your providers. We are moving now to a point where there are pharmacies now who are interested, and we're working with them to get vaccines so that they can also be able to administer. We can't announce the pharmacies yet because they need to work out their own logistics as to how they want to do it. But we're trying to work with as many providers within the community as possible so that we're not reliant on mass events, although we certainly are going to do mass events when we can get mass quantities.
Great. And before we go into specific questions about the vaccine and the options and so forth, let me just go to our city manager just for a moment. Mr. Price, could you explain to our residents what the city's role in this process is?
Thank you, Mr. Mayor, and thank you to the entire team for being here today. It's a great question. It's obviously it is the primary responsibility is with the State Health Department, and they've been the quarterback of our unified command this whole time. So they've been the incident commander, but we've been right there with them by their side, providing support. And some of that support is personnel support in terms of logistics and planning and implementation of certain parts of our response. And the response has taken many different forms as the pandemic's evolved, and so the services that we've provided and the support we've provided has taken many different forms. So from coordination, getting all the right players on the same page in terms of messaging, in terms of the facility improvements that we've made to be able to keep services up and running, and now into deployment of the vaccine. So the city owns a lot of facilities that we can use to help stage events, some of our community centers and some of our larger facilities. And so we're working with the health department to figure out what types of facilities and where in the city would be best to be able to get vaccinations distributed to employees and to the community, and then any other resources and support that we can provide. So I work with the other city managers to talk about what's going on in other communities. We share information and advice, share that advice and experiences back with the health directors. So really, what the city can offer is facilities, logistical support, and then just general support in terms of anything they might need, from messaging campaigns to getting the right folks in the community on the same page to make sure that we can have an effective plan for the community and then be able to implement that plan as efficiently as possible.
So you mentioned that you talked to the other managers in other cities, and I know Dr. Welch does that as well from the health department standpoint. I've received a couple of emails saying that, well, we're behind the others. From your conversations and that's how you feel, where are we in terms of compared to other cities?
I think that's very interesting that you've heard that. I've spent a lot of time of my career in other parts of the state. I have a lot of connections, and I don't know anybody that's ahead of us right now. And So I too saw that message, but every community has to make choices for themselves about their priorities. You'll hear a lot today, and you've heard a lot in the past few weeks about the tiers. The health department's worked a lot with us and our community partners to identify what's most important in the city of Chesapeake, and that might not be what's most important in other communities. There was some information in the newspapers and in the media this week about teachers getting vaccines, and that we're moving into 1B maybe a little bit more quickly than 1A, and I'm sure we'll be talking about that a little bit today. But we have made a choice in Chesapeake that getting kids back to school as quickly as possible is the Chesapeake way. And for kids that want to take advantage of online resources, the city's deployed millions of dollars of technology in terms of devices and wireless capabilities to make sure that can happen. But for those families that choose to have kids in an in-person environment, the key to making that happen is getting the teachers and support staff vaccinated. And so for the city of Chesapeake, that's the right choice. Many other schools are closed. Many other city halls in the region of the state have never reopened. We were the first, I believe, in Virginia to reopen and start providing those in-person services. So again, each community has to make these choices for themselves, and having Dr. Welch and her team and then our emergency management people side by side throughout this entire pandemic, and really before the pandemic began, the relationships that we've had in this city for decades, that's why we've been able to do this effectively the Chesapeake way. And I got to tell you, from the jurisdictions I've seen, I think we're second to none.
Great, thank you so much. And you're not the only person that I've heard who's talked about our special relationship with you, particularly Dr. Welch. You've been so open and helpful for the schools as well as the city, and we have a unique relationship because you've been with us and you are Chesapeake. And so I just want to thank you for that, and thank you for those comments as well, Mr. Price. So there are actually two vaccines out here, and I want to throw these to our health experts, and whoever feels they need to answer, please do. There are two vaccines out there now, and so my question is, are they the same, and is one better for some people or some conditions?
I'll start it, but Marian may want to respond in terms of the logistics, because there are definite differences in terms of administration and concerns from the vaccinator perspective. With regards to the studies that have been done and their effectiveness, they're pretty similar. They have done testing and control groups with over 30,000, thousands of folks. So the results seem to be for both that with the second, both of them do require a second dose, that there be over 90% protection. There is a difference in terms of the timing between the first and the second dose. Pfizer, you get 3 weeks after the first, and Moderna, you get 4 weeks. And there is a difference in terms of the youngest age where you can take it. With Pfizer it's 16, and with Moderna is 18. So there are differences in that. There may be some differences in terms of side effects, but most of the side effects are similar to other vaccines: fatigue, muscle ache. I've had the first dose, and it was like getting a tetanus shot. I'm hearing that the second dose may have a little bit more symptoms. I guess time will tell, and we'll be able to see. A big difference from the administration perspective and the vaccination perspective is the logistics. They have huge differences with regards to storage, temperature, even drawing up the vaccine, and Mary may want to address that.
Yes, so what we have found in working with Chesapeake Regional Medical Center, because we have partnered with them now to give several thousand vaccines to healthcare workers, the Pfizer vaccine does require, it's a much more delicate vaccine. It has to be reconstituted or mixed with a diluent. And so they have actually had their pharmacist on hand to do that process. But it does add a time factor so that, you're spending a little more time in between patients to take care of that vaccine. The Moderna, on the other hand, it can sit on the table longer at room temperature. Logistically, it's easier to utilize, and certainly that's the vaccine that they're now sending out to pharmacists if they have ordered that vaccine. Private practices that decide to order the vaccine will most likely be getting that because it doesn't require the expensive equipment that the Pfizer vaccine requires, such as the freezer, the ultra-cold freezer.
Thank you. So let's talk about the tier system, and we have that in place now as of January the 13th, 2021. We don't know what tomorrow is going to bring, but that's the system that we have, and that's the system that we are planning on operating as. So who would like to respond to explain what the tier system is?
So normally in the past, we're all familiar with the flu vaccine rollouts where, you know, it has been 65 and older and people with high risk chronic diseases that really should be prioritized and go out and get that vaccine. The Moderna and Pfizer vaccines have been distributed. There is such a limited quantity at this point in time, although they have ramped up production tremendously. But that vaccine, first of all, it's 2 doses, so that if they have produced, you know, 1 million vaccines, they have been holding back half of those for that second dose. So that right there has limited the vaccine. The state has followed the Center for Disease Control guidelines on the tiers, and they were developed based on maintaining critical healthcare infrastructure. The healthcare workers who are working, especially hospital-based healthcare workers, that they are basically, you know, face-to-face with patients who have COVID, who are very sick and you know, that are communicable. So the healthcare workers were deemed the priority to try and keep that healthcare system up and running. Now we have in Chesapeake, we also have worked, there's a pharmacy partnership, and we have worked with all the pharmacies to get onto that system. It is a direct partnership between pharmacies, CVS and Walgreens are the 2 that have contracts with the Center for Disease Control, and they have, and they voluntarily stepped forward to also take care of people in long-term care facilities, skilled nursing homes, whose rate of death is much higher. We're finding, you know, large numbers of cases and staff in those facilities. So Walgreens and CVS are actually going into those facilities over a period of several weeks to vaccinate both residents and staff. And again, you know, I have to impress that there's a second dose involved in this, so it does extend the time to try and cover everybody with some protection.
And I think we were, as you're talking about that extended time, one of the questions I've been asking is, because their other philosophy, I guess, is to go ahead and just give it, and have faith that the next one's going to be, you were going to have a resupply to give the second one. That's been one of the arguments, but I don't think that we know whether that 21 days or 28 days, how sacred that number is. In other words, if someone were to wait several months later, would it be as effective? Is that correct?
That's true. Remember, this is an emergency use authorization. So as frustrating as it is, we are also learning new things as we go, and we need to utilize that new information. But there is some conversation in the research about just what you're saying, how sacred is that 3-week or 4-week. And in my mind, it's most important, of course, that we get the first vaccine. I think we definitely need to get the boosters. And are we going to feel that the 3-week and the 4-week are completely sacred? I'm not so much concerned about that as I am getting it to them. Right. Yeah. That's really my concern, is getting it to the public. And as as we've sort of alluded to at the beginning of the conversation, there are peers or priority on the pyramid. We have certainly shown the pyramid a number of times, 1A, 1B, 1C, and they're different levels. But I'll be perfectly honest, just like you mentioned, Mr. Price, it's important that we know the priorities of our community, and we combine that information with the pyramid. So we actually do blending. I'm not going to open the door, close the door, and make strict boundaries. I'm interested in serving our community and the needs of our community, and our community may be different from other communities, and that's okay. This is where we live, these are our citizens, and our commitment is to our citizens.
Well, that seems like a very reasonable and sensible approach. So how many vaccinations have we actually gotten out at this point? Before I ask the question, I will go back to Mr. Price. You and I were talking about this thing yesterday, and you know, everybody wants to know the number today and who gets it today. But if you probably look long range in 5 or 6 weeks, that won't be as relevant a question, because we hopefully will have worked out many of these things, and then everyone will have easier access. I hope that's the case. But where are we, and what are your thoughts?
Right, so at this point, the first vaccine, and I know it seems like it's been a year since we've been doing this, but the first vaccine actually was not delivered to Chesapeake Regional Medical Center until the week before Christmas. And they received 2,200 doses, and it was the Pfizer vaccine. And they immediately scheduled clinics the following 2 weeks to start the week before and week after to vaccinate all of their healthcare workers within the hospital. Now, the holidays was a factor, and they had a somewhat low uptake or acceptance rate for that until the holidays were over. But they did open it to other healthcare workers and private practices through the community. And so we partnered with them and assisted in the vaccine distribution. Now, those 2,200 doses require a second dose. And they started that second round this week. So that's another 2,200 doses. In the meantime, we have done some smaller clinics with 500 healthcare workers. We're scheduling about 800 more healthcare workers in the next couple of weeks. And of course, this week we started with the schools. So once we get through this first round of healthcare workers and first and second rounds, because this is a moving target. This number is never exact. It's always changing. We'll have given over 10,000 doses in the first month. By the 18th of February is where we will be. Our goal is to try and get all healthcare workers completed by that time so that we can continue to expand our vaccination of the essential workers, the 1B workers. There are a lot of them. And, you know, obviously we made decisions, and we've also been given some flexibility from our guiding principles from Virginia Department of Health to use some common sense, and if you want to try and expedite things, that you can start blending that 1A and 1B. It's not an exact boundary any longer.
I think that's a good thing to hear. I think a lot of people would agree with that's a reasonable way to go, so thank you for that. Let's talk about the vaccine itself. Is it actually a live, is the vaccine actually a live COVID, or is it something else?
Actually, this is one of the most exciting kinds of vaccines that could have come about. It is using what's called mRNA, and Pfizer actually had been working with this concept of using nucleic acid, the genetic type components, for about 30 years, because they've been working on creating a vaccine that may reduce genetic disorders that are caused by genetic malformations. And so they basically utilized this concept to develop the vaccine, which made it so that it could be developed much faster. I know a lot of people think, well, because it came out so fast, it must not be as safe, but it's because it's a totally different technology. What they are doing is, you mentioned live or attenuated. It used to be that for every other vaccine, we would grow it in eggs, and then it would either be an attenuated virus or it'd be a dead virus, and that's what we would give to you to develop the antibody. This is totally different. You don't have to grow anything, and it's not a virus. What they've done is developed a technique to develop an antibody to the spike. You know, you see the picture of the COVID with the spike. That's not just kind of a cute picture. It's really what it looks like under the electron microscope. And that spike is not just for looks. That spike is sort of their key to get into the cell that will cause disease. So this technique with the mRNA, which means messenger RNA, the nucleic acid, it is developing the sort of what that genetic component of that spike is, so that's what's being given to you. So your body is developing antibody to the key for them to get into the cell. So it destroys their ability to open up the cell and get into our cell and cause disease. It's a phenomenal new approach, which actually reduces dramatically the kinds of side effects one would expect for people who previously with the vaccine were allergic to eggs, for example. They might have trouble with the vaccine, but that's not even a part of this. So it's really amazing technology, and it has helped to produce it much more rapidly.
That is amazing. I'm glad we have such smart people who figure something like that out and have done that so quickly. Is amazing. So you mentioned the antibodies. My next question is, so if you've had COVID-19, or I think there are tests out there to determine whether you have antibodies in your system. So if you test that you have those antibodies, or if you've had COVID-19, should you still get the shot?
Yes, actually, but you don't get it right away. If you've had the COVID, then there is a waiting period of about 30 days, could be longer. And that's because we're still learning so much about the longevity of antibodies, both with the disease and with the vaccine. So for actually the value and the need for maximum protection, yes, even if you've had the COVID, but you do not want to get it within at least a 30-day period of when you've had the disease. And then, yes, you should get the COVID vaccine. There are also considerations if you've had, say, another vaccine, say a shingles vaccine, because a lot of people in the risk age group would have done that. And so you need to wait at least 14 days. And that's also a factor so that our immune system, our antibody system, it doesn't get kind of confused. Gee, I'm supposed to develop antibodies to this, and it's not really a good multitasker. And so you just want to have one task that it's focused on. So you want to be outside that realm of when your body would be responding to another vaccine. And so that's generally about 14 days.
So these tests that some local pharmacies are offering to test your level of antibodies, would the same apply? First of all, is that a valid test? Is it something that you can sort of rely on? I know they will tell you they don't know how long it lasts, but at that point, you have these antibodies.
Yeah, and that's the key. And it's like even the test in general, for both the test or the antibody, right now, because this is new, the best we can say is that test is relevant and valid for that day.
Gotcha.
It doesn't tell us about a month from now or 6 months from now. So, or for a test in terms of the antigen test, for example, that is a really plus minus kind of a test, because it takes a while before tests are positive. Let me just put it in perspective. The test is related to the incubation period, the time that from the time of exposure until your body is able to actually rev up when they're exposed to the virus, to rev up your virus so that you have large quantity and concentration, you can cause disease, and then to get to the organ, say the lung, that it is going to mainly affect, and only then, when it gets adequate amounts of that virus, does your body adequately respond to it to develop the antibody. So, and that's called the incubation period, and you get the disease, and that's when the test is. But measles, for example, that incubation period can be 7 to 21 days after you've been exposed until you develop the disease. Flu, it can be 2 days. So all these germs, just like people, are different and unique. And so these tests, if you take them too early after you've been exposed, you could have a negative test. The next day it's positive and you're contagious. So we have to balance so that we're not placing all of our faith in just a test that maybe tells you about that one day. So
That's so hard to do, so we're conditioned to
I
believe,
know,
you pass
I know
a
we
test,
are.
then you move on. I've
Right.
conquered it, yeah, so that's hard to
And that's what's
change thinking.
contributed.
Yeah.
That is exactly what's contributed to our increased exposure and our rising surge rate, because people have a test, say on day 3, I was exposed to X person. Day 3, my test is negative. Okay, I'm going to go to that social gathering or that
Right.
party on day 5, but by day 5, now my viral load has revved up. I have more in it. I'm contagious. I don't think I am. And you can be contagious 2 days before symptoms. So instead, you're there giving viral gifts to other people at the party.
Right.
So that is why, to be perfectly honest, I like to say that quarantine is a mitigation strategy. We quarantine like crazy, and we do that in the schools, because if there's been exposure, we want to get them quarantined out of the opportunity for, if they develop the disease, not everyone who's exposed develops the disease, but we have no way of saying at the outset. But if they are the one who develops the disease, they're not going to be in an environment where they can transmit it to lots of people. That's really our goal. So I know a lot of people are frustrated sometimes with the quarantine, and even in the schools, we've quarantined over 3,000 folks, but it has resulted in an incredibly low transmission, and that's really our goal.
We talked a little bit about the side effects, and I know there's not, certainly we don't know that everybody's going to react the same way, but I think we've heard anecdotally that there are a number of people, particularly the second shot, that are having achiness and so forth. Does it make sense, and I think, Mr. Manager, you and I talked about this, does it make sense for organizations or companies to sort of anticipate that and maybe not give everybody in one department the vaccine the same day, spread it out over a couple of days? Is there enough evidence to indicate that that would be a good strategy?
Yeah, actually, that is the recommendation. I think what we're finding is that that first dose, many people have such mild side effects that it doesn't impede their ability to come to work or to function. And perhaps that second dose might be the one that, causes more issues. But recommendations are that you don't schedule everybody at one time to get the vaccine. And the hospital staff, for instance, is a very good example. They did small percentages of each department so that if there were issues and those people could not work, they would have adequate staff to continue services. So that certainly is the recommendation.
Okay. So going back to the tier system and the distribution issue, for the average person, when should they anticipate being able to get the vaccine? I know that's a tough one.
Yeah, and right now, the vaccinators in Chesapeake have been Chesapeake Regional Medical Center and Public Health. That's who has received the vaccine. We have made a very strong effort to try and get more participation from the private sector to sign up and become vaccinators. We have had some sign up. There is a process that they have to go through. It's an online process, and it is a Center for Disease Control application form, mainly to state that they will utilize all the vaccine they get, that they will handle it appropriately, that when you get that vaccine, that it's been kept at the proper temperature, and that you're not getting a vaccine that might be inactivated because it wasn't handled correctly. We are also now working with pharmacists, and just yesterday received a list of 5 pharmacies in Chesapeake now that have ordered some vaccine, limited quantities right now because this is very new for them, and they have to figure out logistically how they're going to handle the possibility of a rush or an onslaught of a lot of people in a small building. So, there are a lot of logistics involved in this, but we desperately need more people to sign on and become vaccinators, because the more people that we have to become vaccinators, the faster this process will go. So our plan is to try and continue to increase participation from the community so that vaccine is going to 100 sites and not just to Chesapeake Regional Medical Center and the health department. And this is what's going to speed up this whole process. We also have looked at trying to put together larger venues, and the city of Chesapeake has graciously given us the access to the convention center for the next 3 months. That's a very large space, it's a large room. We have to consider distancing and not crowding a lot of people in one room when we do these clinics. And we also need space to have a waiting area once they get the vaccine to make sure people are not having reactions. So we are going to be setting up in that site probably a couple of times a week so that we can have large volume clinics. And so those large volume vaccine events are what we need, but we need vaccinators and desperately need vaccinators.
I'm glad you mentioned the conference center. I did receive a call from a friend of mine yesterday, I believe it was, that also manages a couple of the very popular radio stations, and they are certainly willing to announce at the conference center. In fact, they're located right beside the conference center and could even set up their show there, announcing all day long that this, call to make this appointment or whatever the procedure might be. But I think getting the word out to people, whether you're trying to recruit vaccinators or whether you're trying to let people know when and where and how they can get their shot, is important. Does anyone want to talk about other ways of getting that word out to our citizens?
Well, I'm not so much going to talk about the word, but we have to balance when we get the word out. Because I certainly don't want citizens, and unfortunately this is what happens, the federal government or the state makes a decision and people see that, right. But that doesn't necessarily mean that the locality can immediately address. A lot of our problems, just as an example, we have had to do a lot of scheduling by hand, scheduling hundreds, literally, by hand and phone call because the system they gave us to make appointments didn't work. So, but we still wanted people to get vaccines. So literally on weekends and holidays, staff were at the office just calling and scheduling with the old-fashioned way with papers, scheduling by hand because we did not want to delay.
Is there any hope that the system can be put into operation so you won't have to continue?
Well, we actually, fortunately, with the hospital, were able to use their system subsequently when we were getting the vaccination at the hospital. So we've moved forward from that, and now they're working on another system, but it's not available until the 25th of this month. So we are sort of working on hybrids with the hospital system. Having the hospital system, the lifestyle center for vaccination with providers has been a godsend in that relationship with the hospital. And we're meeting with them again today, by the way, to look at other ways that we may be able to expand and get larger vaccination quantities. We are certainly looking, we've submitted money to get 20 vaccinators because it's an emergency use. Again, there are many more requirements on the training and all of the stuff that has to happen before they can vaccinate. The school nurses are helping with the school, but they had to go through a lot of training to do that, and these are nurses who give shots. We're also working on on working with, just sent communications to the hospital and to ODU to see if we can get nursing students, to see if we can work kind of a balance, because we want to take advantage of the city's gracious offer for the conference center, which means that we would like to give thousands of vaccines, as opposed to at the Lifestyle Center, we give hundreds and we're happy. But we want to give thousands at the Lifestyle Center. And during this whole process, of course, we need to be especially cautious that we maintain distancing. And that's why the appointment system is so important, is that we really need to set up an appointment system, and we need to have it combined with other means as well, because a lot of folks don't use electronic systems to set up appointments. So we're trying to balance all of that. And this is where use of the private sector comes in so importantly, because they know their patients.
Right, you're talking to pharmacies and the doctor's offices and so forth, yes. It is certainly a time to be creative in thinking about, ways to get these appointments, way to get vaccinators, way to get people informed. So it's certainly going to be testing yours and ours, and hopefully people out there that are listening, their ability to come up with some solutions and suggestions. And it's good, important that we continue to be open and listen to those. So this vaccine, do you think that it's going to be something that's every year, or is this a one-time deal?
If I were to put my money in anywhere, I'd probably say once a year. My joy would be if they could combine it with the flu, as they did with the H1N1 that is now in that shot as well. That certainly makes it much, much easier. But the dilemma there is that currently this vaccine requires a booster, a flu shot every year, but you don't have to get 2 every year. So that gets more into the research and the methodology, and that's beyond my skills. But that would be my dream, is that it could be a part of the flu shot.
We're sort of running out of time, but we haven't really talked about those that are just resistant. Some people think that this vaccine was developed rather quickly and that they're somewhat skeptical. What can we do to convince people that this is the right thing to do, and how can we respond to how the vaccine was created?
This roundtable is one way. So I certainly thank you for that. And I think that the more that we can help people to understand even the methodology, I'm not saying to understand the science of it and all of that, but this was rapidly produced because it's a totally different methodology. We didn't have to grow a virus. So, and it's a process that Pfizer has been working on for 30 years for different reasons, absolutely. But the methodology is what they had years of experience with. So I feel very comfortable with the vaccine because of that, and I'm very excited by it. I'd love to see all of our future vaccines produced in the same way, because it can be done much more rapidly, and I just think there are less reactions to it. It's a much better type of a process. So I think the more that we have this kind of conversation, and we certainly try to put out, we have one person who's a public relations person, and we try to put out through many social media, and we work with Heath, and I guess Liz isn't here or somewhere here. We work with the city so that we can distribute this information, and having opportunities to just present the information. And we know that, especially on something that's new, it takes a minimum of 3 times to say it before people really digest it. And that's not an insult to anyone. That's for me too. It's for anybody.
It's human nature.
Yes. Right. It's just the way that our process works and our thinking works. So, but I think an important thing to know is we want to be transparent. Some people think if we're not distributing information all the time, but I want people to understand we're getting changes laid on our table all the time, and we're trying to balance all that and to work so closely with the city so that we can have priorities consistent with the city, with Chesapeake.
I think that's one of the most challenging things, is that if you look at this virus, when we first had our roundtable, we talked about, you don't need to wear a mask. And then as we are discovering, it's been an ever-changing process for over a year. And so that is what does in fact add to the confusion. And so speaking of change, there's this word that is a mutation. Can you talk about the muting coronavirus?
Yes, there has been a mutation, which is not unusual. These viruses are smarter than we are. They change. I mean, we can't change as well as they can for things we don't like, but they can change, and they change all the time. But the studies that have been done show that the vaccine is effective against it because, again, it's not the spike that is changing. It's some other components of the virus itself. And so the methodology that is addressing the spike so the virus cannot get into your cell is still effective from all the research that's been done, even with the mutant gene.
Well, that's all the questions that I have prepared. Is there anything that anyone here would like to address that hasn't been talked about you think that people need to know? Mr. Tucker, did you have anything else that you'd like to add to the conversation?
Well, thank you, Mr. Mayor. I just want to thank you for allowing us to be here. As the city manager pointed out, we have a strong working relationship that we look forward to continuing. Some of the efforts we're looking at, as Marian discussed, was the use of the conference center long-term. That's going to be huge in being able to allow us to do large-scale events, mainly because when we're trying to get logistically a lot of people in one space at one time, we obviously need a lot of area. The geographic region is ideal, and parking is also an issue. We also have an MOU agreement with Parks and Recs, so the community centers are also on our radar. And in fact, we're going to be using the Great Bridge Community Center next week, so we're very thankful for that. Right. So we appreciate all the logistical support from the city.
Well, great. You mentioned the conference center. I'm not maybe out of line throwing this out there, but we do have a chef there that offers lunch every Wednesday and Friday. So after you get your shot, you can maybe get an appointment with our chef and spend your $10 for lunch there as well. That also for all the workers that are there. Mr. Manager, any closing comments or thoughts?
No, I just want to reiterate, thank you for organizing this. As the pandemic has evolved, I think our messaging has evolved, and I think these roundtables are great to continue to get that message out. And thank you to the entire team for staying engaged, staying in this the whole time, keeping the community up to date, and most importantly, doing everything we can to keep the community safe.
So maybe we want to think about our theme continuing, don't throw away your shot, because we certainly want to encourage everyone to do this, even those who think that it's probably not the right thing. So again, thank you so much for being here, and I hope that as things develop and we feel like there's a need to continue with this, whether it's a week from now or 2 weeks from now, we're certainly open to do it if we can be helpful in getting the word out to our citizens. That's what we're here for. So thank you once again, and thank you for listening with us today.